All right, so let me apologize first. If you're here for an answer, I do not have it. So if you want to leave at this time, that's fine. So I was given this title actually by Bob. And so first of all, I'd like to note that the we is a royal we, and it is a lot more. The co-authors on this paper, Dr. Emily Mahan Riggs, who did a lot of the prolapse work while she was a student, veterinary student at North Carolina State University, and has now joined our team in the South Central region. And just started vet school this year. Jamie Madigan worked with us from January until just recently when she started vet school, and did a lot of what you're going to see today, did a lot of these sow postings. So all of this work and all the pictures you're going to see is because of Emily and Jamie, all right? So introduction, sow mortality has increased in our system over the last 5 years. I'm going to show you some data that will just sort of highlight that. If any of you have seen my prolapse information, it's really been focused on prolapse, but I'm going to show you just overall sow mortality numbers as well. We don't have a clear idea what the root cause of this mortality is. And so there's been changes in health programs, therapy, management, et cetera, and none of those have been rewarding in reducing sow mortality in any of the farms, individually or as a whole in our system. This mortality increase is highlighted by prolapse issue. It's about 5 times the rate as it was when we first started to see the increase in overall sow mortality. But then there's also been increases in lameness, which is about 2x the rate, and then sudden death or unknown, which is a little less than 2x the rate that it was historically. And there's obviously welfare concerns with this, both cause and effect. So I think one of the things I'll show you is as our welfare programs, particularly on our company sow farms, get more intense, we have third-party audits, we have animal welfare audits on a routine basis, those employees are more likely to euthanize an animal if they have something like lameness or a condition. And it's getting a little bit more scrutinized, the fact that I think there's animals that we historically would have put on the coal truck or been able to get on a coal truck that would have been accepted by the coal market that are no longer acceptable. And so I think we're seeing some issues in increased sow mortality because of the welfare and just we're not taking a chance on those animals. But in addition to that, the increase in sow mortality itself is causing this welfare question. And I think as an industry, we need to really address that, because if anybody outside of our industry starts realizing, hey, there's a lot of dead sows, there's prolapses, there's lameness, and we're not doing anything about it or we're not addressing it, that could be a bad deal for the industry. There's a huge morale issue, both with the employees that have to first euthanize these animals if they require euthanasia, but then also to physically drag these animals and remove them from the barns. There's a frustration on management's part because we don't really have any answers, and this problem is only steadily getting worse. And it's a morale issue for the veterinary team as well, because I don't have an answer for you, and it's frustrating, and that it feels like it kind of falls on my shoulders to help answer this question. So my role over the past couple of years is try to understand that and get up in front of the industry and provide you with our information and maybe spur that conversation as an industry and a group and try and move something forward. So that's part of what I'm doing today. And then obviously there's a huge cost to it, and a really nice presentation on prolapse cost at this year by Taylor Homan in the student session on Sunday estimated that 1% prolapse was a cost of $13.5 per inventoried sow for every 1% increase in sow prolapse in that system, or that farm that was studied. So a huge cost. This is our annualized sow mortality, and when I speak about this is for North Region, so we're 105,000 sows on 35 sow farms currently. And so this is our annualized sow mortality from 2008 to 2016, and you can see in that period of time our sow mortality has doubled. Really a step change here in 2012, and then this linear change has really been highlighted by the prolapse issue that we've seen. If we look at the reasons when we go back 2008 to 16, these are the individual remove reasons in our pig nose record currently. Realize that some of this was combination of an old record system and a new record system, and so that's why you see things like lame and then also lameness. But this is the breakdown, realizing that there are 87 different options of why a sow was removed, and I think that's one of the concerns in the industry as we start looking at these management systems is there's just too many boxes to put that sow mortality in. Really, the bulk of our mortality falls in sort of 3 general boxes or categories, and that would be sudden death or unknown that I would group together, lameness or downers, which I would group together, and then prolapses regardless of type. And so that's essentially anywhere between 92 and 97% of our removals is because of one of those three causes. And this is the actual sow mortality, annualized sow mortality for each of those causes. And you can see this is where that 5-time increase change from 0.5% prolapses to over 2.5% on an annual basis. For lameness or sudden death, 2.2 to 5, and then sudden death or unknown from 3.8 to 6.5. So we've seen an increase over that 5-year period in all three of these categories. And some of it, I think, is they're related. Maybe there are different things going on, but in some of those cases, particularly the prolapse and the sudden death, I think some of these sudden deaths, we'll talk about the bloat that was mentioned in the last presentation a little bit as well. I think some of these animals that die suddenly just didn't live long enough to prolapse. So you'll see this boost here in the lameness from sort of 2.5 to 3.5. This is when our system did a lot of conversion to group housing, and that was one of the biggest things we saw with going from crated to group housing. We used smaller pens, six sows per pen, but we saw an increase in lameness, both in the replacement gilts coming in and then just the animals that were on the farm. So we had a little bit of a blip there, and then it still continues. This is what I was talking about, the impact of welfare. So if we look back at 2008, the percent of mortality on the farm that was either death by sudden death or some cause where the animal died on their own versus destroyed or euthanized. And you can see how that has increased and sort of leveled out. So it's either we're euthanizing more sows because of the concern with welfare, our threshold of acceptance is reduced, or whatever's causing that euthanasia has just become more severe, like the prolapses. It's not just that we're seeing an increase in prolapses, it's the severity. I mean, the entire inside of the animal is sitting outside of the animal sort of deal. But I think there's an impact there of this welfare program. If we look at distribution of sow mortality by year within our system, and so what this is all 36 farms, it's not just that bad farms got worse. Even our good farms are still at an increased sow mortality percentage. So the whole system has shifted. There's still a wide distribution, anywhere from some of these farms that are running 8% all the way up to 25% annualized sow mortality. So there's a huge spread across those farms, but the whole average has shifted. So some of the challenges of this, if anybody has done a lot of sow mortality work or sow posting, it's not an easy thing to study. If you look back at historically the sow mortality work that's been done, you get a lot of divergence in causes of mortality. It's an exercise in stamina both physically and mentally. I mean, it is a lot of work to post a sow, particularly if you've got to do multiple in a day. And then mentally just trying to keep track of everything that's going on in that sow and sorting through what's real and what's sort of an incidental finding and how that relates to everything else that's going on clinically on the farm. The diagnostics, at least for us, has really not been as rewarding as it is with normal necropsies and growing pigs. Some of that is you can't purposely select animals in the population that you want to euthanize because of the value of the sow. So you're sort of stuck with what dies or what needs to be euthanized that particular day that you're on the farm. Mostly the histopath that we've seen, the culture and really PCR tests, most of these lesions tend to be chronic. So you get chronic infections in the lesions or you get no diagnostic lesion whatsoever. And the value of culture and PCR is pretty much non-existent. We're not getting active positive viruses and bacteria in these cases. So gross evaluation might just be as valuable. The problem there is you have to be very good at gross evaluation. All right? And then with sows, because they've been around a long time, are you even looking at the current problem? We see these incidental findings in a sow because they've been around for 3 or 4 years. And you sort of sometimes go on this goose chase. We see a lot of cystic kidneys, so that's probably not having anything to do with the sow mortality, but it's interesting to note. And you make that note, but you make sure that you don't go on a goose chase following something that's incidental. There's a limitation in the number of affected sows. So even at a 15% annualized sow mortality rate on a 3,600, that's only 1 or 2 sows per day averaged. And so it's almost one of these deals where you have to live on a farm to get a really good number of sow mortality, or have somebody that's working on the farm do that posting for you, but there's limitations with that as well. Particularly if you can't give them an answer, they just stop posting sows, right? It's a lot of work. It takes away from their daily capacity. We've got a lot of new people on the farm, high turnover. They have another job they have to do. It's not a priority for them to post sows. And then you get variable information back when you actually try to do that. The value of the sow often precludes active selection of samples. So this is, I just can't go into a population of sows and go, I want this sow, I want that sow, I want this sow. She may be pregnant. The value of her cull value, there's the value of that sow that a lot of time precludes euthanizing that animal and collecting samples. And then usually what all this happens, it turns into just a data analysis of the farm, right? And our ability, we've got tons and tons of data. A lot of that data is probably not clean. And then the analysis is really nobody in the system has time for that analysis. And at the end of the day, you get a lot of noise and risk factors. And so hopefully there'll be some focus here in the future where we can look at that a little bit more statistically relevant in an epi sort of way. So here are the caveats to what I'm getting ready to show you. I know it said a lot of sows. It was only 53 sows that we posted. That's not really a lot in comparison to other stuff that's been done. So these were kind of the most recent sow mortality surveys that I pulled out of the literature. I think this was a really good paper here. That's AASV 2009. So this is Sarah Dillon or Sarah Huff now. When she was working with the Hanover Company one summer, basically she worked on that farm for a summer. And when a sow died on that sow, she posted that sow. And I think that was the best way to do sow mortality workup on an individual farm. One of the best sow mortality projects that I'd seen. And then other work in 2007, 2099, so we're looking at between 72 and 270 animals, this being the largest one. So by comparison, we didn't do that many necropsies. So I don't know that it classifies as a lot, but we'll show you what we got on the 53. And this was limited number relative to the scope and individual herds. So this was an on-call process. So Jamie, when we got her set up, basically she would receive texts or phone calls from all of our farms by 8:30 in the morning, and then she would prioritize the farm that had the most mortality or the most prolapses, and she would run out to that farm. And so it was an on-call deal. With our biosecurity measure, it kind of limited. She could only go to one farm a day, and then if she went to a dirty farm, she had to have their appropriate downtime. So it really kind of limited, her just running all around and collecting those samples. It was mortality for that day, so it was highly variable. So it could have been one animal, or it could have been, I think the most she did in one day was 5, and so it just was luck of the draw. And again, limitation of just one farm per day. And the other thing is she jumped around from farm to farm to farm in our system, so I think we've got about 20 farms represented on that 53 sows. And so it wasn't consistent within a farm. Maybe it would have been better to do that. This was highly biased sampling, so it was mainly destroyed sows, not necessarily acute dead, sudden dead. We had a few, but most of it was mainly destroyed, and a lot of that was because it was prolapse. This was really focused at this prolapse problem that we've been seeing. So they were prolapsed animals. They'd get a call. She'd arrive to the farm. They'd euthanize that animal, and then she'd collect samples. So most of the samples were fresh, but it is biased because it's a prolapse sow, not necessarily sows with a problem. Not that prolapse, uterus and everything isn't a problem, but it wasn't sudden death or unknowns or anything like that. If we had animals that were lame that needed to be euthanized, we would euthanize those animals as well and collect samples. But about 80% of what we did were these prolapse sows. Unseasoned investigators, and that's not a knock to my co-writers, that includes me as well. I have not historically posted a lot of sows. And so posting a sow and looking at it grossly and trying to understand what's going on is not as easy or as efficient as going into a nursery or a grow-finish population and doing that. So I think all three of us were sort of new to this whole process and what we were looking for in a sow. It was seasonal, so we did this from January through April, and then in April we switched over to some other summer projects using Jamie, and then limited diagnostics. So really we kind of limited it to histopathology. Initially we were doing some cultures and PCR, but we weren't getting a lot back on that and spending some money for no data, and so we decided we'll just stick with histopath of the major organs and then any additional organs that looked different or looked abnormal. And then really, focus continued to shift. Again, prolapse focused. We would get non-traditional sample collection. We were collecting blood, we were collecting urine, we were collecting abdominal fluid. Every time we'd find something, we'd get a new idea on what this might be. We'd kind of shift our sampling methodology for what was going on. So I'm going to show you, really what I'm going to do is kind of give you a list of directly the reports that came off the histopath for these animals and show you some pictures that correlate. And this is one of the issues that we see with sow mortality, and when we've done it in the past, is you submit it all and there's nothing, right? There's Not observed. Incidental finding. No lesions. No pathologic changes. No lesions. Unremarkable. Nothing there, okay, at least from a pathology standpoint. And we got a fair amount of that on these samples. But some of the things we did see that was kind of surprising and stuck out is we saw a lot of kidney lesions that would indicate some sort of septicemia, whether chronic or acute septicemia. And so not consistent across all farms necessarily, but a lot of lesions indicating septicemia, specifically in the kidney. In addition to that, we also saw a fair number of bladder issues, stones here, and then pus in the bladder here. So with that, between the kidneys and the bladders, this is probably the most repetitive thing that we saw. So we're getting suppurative cystitis, suppurative pyelonephritis, purulent interstitial nephritis, aggregates of lymphocyte in the renal, and mixed polynephritis. So something going on in the kidney, or at least the kidney is representing a systemic septic process. When we looked at the hearts, and we kind of chased this for a little bit, we were seeing some lesions, nothing really consistent, but we would post some sows and we'd have what appeared to be really excessively large hearts. And there was a presentation on Sunday about hypertrophic cardiomyopathy in sows in one herd that I thought was interesting. And I know talking with Steve Henry, he's done some work with this as well. This is an area that maybe we need to at least investigate as a potential cause of sudden death. But edema, fibrosis. So again, here on these, fibrosis, so a lot of polysericitis on the heart and lung in some of these animals. So again, indicative of a septic process at some point in history. Now, a lot of these were chronic, no evidence of active inflammation. So this is something that happened in the past. Again, is this something that's causing the mortality, associated with the mortality, or is it just an incidental finding from when that sow was younger? Reports in liver, some congestion in some of the livers, periportal fibrosis, again, suppurative foci, so septic process identified here in the liver. But what was interesting is some of these livers that were congested in association with issues with the heart, whether that was epicarditis, pericarditis. In addition to that, increased fluid in the abdomen, which kind of leads me to the bloat issue. So here's an enlarged heart, at least relative to the sow, some adhesions here on the lungs. But again, is this just a chronic lesion and incidental finding? Probably not the cause of why we had to euthanize that animal that day, but maybe indicates something going on in that breeding herd population, which I'll speak about. Congestion of the liver, again, here's some fibrosis of the liver indicating peritonitis. And this is one that we've seen historically come and go with our prolapses as well. So increased fluid, abdominal fluid. I know some may say, well, there's torsion of the gut, which is a common finding in sows. But even in sows where there's no evidence of torsion or pelvic organ volvulus or anything like that, just a massive amount of fluid. And these would be our bloat animals, similar to what was described in the first presentation. And same sort of process. We've got one farm that really sees a lot of this, and it sort of coincides with increases in prolapses. And I don't know which is first or second, but I can imagine that if that sow's got bloat and she's got all that fluid and massive internal pressure in the abdomen, that could potentially increase her risk of prolapsing, particularly around the time of farrowing. But we would see the same sort of thing. Full feed system. Immediately after full feed, you'd have a percentage of animals that just get this bloat, this swollen belly. You can actually thump them like a basketball, and that animal will die. We have not been successful with treatment of that animal, but those animals are pretty predictable that they're going to die within 24 hours. And when you open them up, there's just massive amounts of fluid. And so in some of those animals, the question is, where is this fluid coming from? Is this maybe related to the congestion and heart failure and maybe that pathology? And I really can't speak to that. I'm just trying to put together a pathway with some of what's going on in these animals. Other comments. So ulceration of the pars esophageae, I'm going to show you some pictures there and talk about that in a second. We did have a few animals where you've got, gastric volvulus or something malpositioning in the abdomen, which is not surprising, but is that really what's going on with all of the sudden deaths? And then this one here, we started doing, working with Iowa State on some troponin testing based on this cardiac issue and some work that Steve Henry had done and our sow prolapse working group. And so we did do some troponin testing, and there were some animals out there that would potentially suggest that they were having heart issues. And specifically what that is and how that relates, we don't know. But I do think this is an area of interest that we should probably look into, maybe more clearly understand what diagnostics are available for our animals, particularly ante-mortem, to understand if this is a concern. But I want to go back to the ulceration issue. It wouldn't be a surprise with the cost of feed in a system like ours that our feed mills are making multiple types of feed, and we're feeding to the grow-finish pig, which means that we're running low grind size on our grains, and therefore predisposing the sows, who are also getting the same ground corn at the same grind size, likely predisposing them to gastric ulcers. So one of the most consistent findings we found in all these animals was some level of keratinization or severe gastric ulceration in these animals. None of these animals would have been posted or died because of gastric ulceration, so we didn't open them up and find a giant clot in pale animals, but it was sort of an incidental finding on those. Again, we didn't open up a lot of acute sudden death animals. We were mostly focused on the prolapse, but the risk factor is there. And so that is obviously one area of concern, but we're kind of stuck in the restrictions that we have with our current feed mills and feeding systems. My other question would be is, does this level of ulceration predispose those animals to septicemia? And then some of the other issues we saw. One other thing that we were dealing with, so in our grow-finish population, would have been 2 winters ago, we started to get increased arthritis in our grow-finish pigs and having issues at the packing plant. And so we brought in some experts and realized we had a pretty severe OCD issue going on in our grow-finish population, and we feel it was maybe some issues with the way we had micronutrients formulated in the diets. We're not really sure what was going on there, but it was pretty clear that we were having some OCD issues in our grow-finish population. And those diets would, our replacement gilts would be on that same program. And so one of the concerns we were thinking about with our increasing lameness was this OCD because it was fresh in our head. And so we would go in and we'd open these elbow joints of these sows, and it wasn't consistent, but we were definitely seeing lesions consistent with OCD on a percentage of those animals. Now, whether that's developing, it's unlikely that was developing as those sows were in the breeding herds. It was probably a problem that was occurring as they were grow-finish gilts that then transferred into the breeding herd. So that's an area that I think, particularly on the lameness, that we need to focus on within the system. And I would encourage any of you out there that are dealing with lameness, make sure you open up those elbow joints. That would be the most likely place. That was something I learned when we brought in an expert to understand OCD. I was opening a lot of knee joints and hind limbs, and really it's the elbow that would be the first place you would see it. So, and then here's some more pretty severe, but chronic, previously healed over infections. So with that, I think in general in discussion, probably the biggest thing is septicemia and chronic infection that we saw in those animals. Whether that was really the cause of mortality or not, or an incidental finding, I think it really did point us to the fact that we do have some septicemia issues in some of these herds. And the question is, are our sow herds just too dirty? We've really stopped medicating in our sow herds. Years and years ago, we used to do sort of routine pulses of CTC or other medications, and we kind of went away from that about 5 years ago. As a routine, really kind of, response to PRRS infections. You put it in, did it help, did it not, who knows? And so we stopped doing that. We've got an overall, reduction in antibiotics because of the pressures we have as a system, a large system. And then the VFD, one of the things that I have to say on Too Dirty is earlier this year, because of the VFD changes, we pulled out some medication in our early wean diets, and a lot of pigs struggle post-weaning with septicemia, M. hyerinus, H. parasuis, strep suis, immediately after placement in nursery and wean to finish. And I think a lot of that is those wean pigs just have a lot more bacteria in them coming from the sow farm. And so that's why I say I think the sow farms are dirty. But then when we think about, okay, let's go in and treat the sow farms, the easiest way to do it obviously is with feed sometimes. But the VFD limitations today, it's really hard to legally treat a sow herd with some of the products we have out there that we'd like to. And so we start saying, well, we'll just water medicate the sow herd. That's easier to do. Write a prescription, get around the VFD. I'll tell you, water medication is not as easy as we may think it is. All right? And I challenge you, if you're using a lot of water medication, to think through that process. But anyway, so that's an area that we're going to start looking into is there a way that we can maybe treat some of these septicemias existing on these sow herds? Lameness, we've seen a huge improvement in lameness in our growth finish population. We've changed some things in our diets. We've changed the way we feed and develop our gilts, so we're hoping that that'll decrease the lameness as we go forward and improve our longevity on those gilts and parity 1 animals coming into the farms. The heart thing, we talked about that. I still think there's an area that maybe we need to focus, but we need to understand that risk a little bit better and have some better diagnostics. Histopathologically, none of the hearts really show classic, say, heart attack or myocardial failure, but there's just noise with the heart. And then the gastric ulcers, is this an incidental finding given the way that we're feeding our animals, or is it truly an underlying risk factor for sudden death or septicemia? One thing I want to do is update. I was appointed to the National Pork Board's working group for Swine Livability Working Group, which is a big umbrella name for all the issues with sow mortality and growth pig mortality. And our first focus is obviously on the sow pelvic organ prolapse issue, but it will also expand into other areas of sow mortality and longevity, such as lameness, this sudden death. There was discussion about evaluating the heart, but in addition to that, also looking at pre-weaning mortality and post-weaning mortality as well. But I wanted to give an update on this because I think part of our struggle and part of my struggle was that there was no one entity focusing on sow mortality, particularly the prolapse. And so after a series of meetings this past summer, there was some funds put forward, remaining funds put together from 2017 for kind of a November to April timeline to initiate a group, a targeted group that would start doing some epidemiological information gathering, visiting these systems that have seen increases in prolapse and sow mortality, putting a consistent set of eyes on this problem across companies and across regions within the country. And to better, one, collectively understand what the level of impact truly is in the industry, we see small operations, large operations, independent farms are seeing an increase in sow mortality and sow prolapses across the system. Identify a core leader or core team that can actually focus on it, so when they get up in the morning, they don't have other things they need to worry about. They can focus on this problem for the industry, not for a particular group or company. Use this epidemiological information to start targeting researchable hypotheses, because right now it's all over the board. There's 20 different things that have worked, and those same 20 things haven't worked. And so the goal with that epidemiological work is to sort of better target testable hypotheses that can then drive research into 2008 and beyond. So just an update for that. If anybody specifically has any more questions about that, Chris Hostetter's in the back of the room, and he can answer all those questions for you.